A deadly virus is spreading, governments are reacting, borders are tightening, flights are being suspended, and once again, the world is watching closely as health officials race against time to stop a potentially devastating outbreak. The latest Ebola outbreak in Central Africa has triggered concern far beyond the borders of the countries directly affected. What began as a health emergency in parts of the Democratic Republic of the Congo and Uganda has now led to travel restrictions, airport screenings, quarantines, and international warnings across multiple continents. But how serious is the threat? Which countries have imposed restrictions? And can the world prevent another major health crisis before it spirals out of control? Let's take a closer look. The outbreak that alarmed the world. The current outbreak involves the Bundibugyo strain of Ebola. Although less well known than some previous Ebola strains, it remains highly dangerous and potentially fatal. Health authorities have reported hundreds of suspected deaths and hundreds more suspected infections. Particularly in the Democratic Republic of the Congo, Uganda has also confirmed cases and fatalities linked to the outbreak. As the numbers continued to rise, the World Health Organization elevated its national risk assessment for the affected region, while the WHO still considers the global risk relatively low. Officials have warned that delays in detecting the outbreak allowed the virus to spread faster than expected. Health authorities are now racing to catch up. The first response: lockdowns and border controls authorities. In the Democratic Republic of the Congo acted quickly by suspending flights to and from Bunia, one of the hardest hit regions. Only humanitarian emergency and medical flights are being allowed under special permission. Meanwhile, neighboring Uganda introduced strict measures of its own. Direct flights between Uganda and the Congo have been suspended, and boat crossings along certain border areas have been halted. Markets operating in border districts have been temporarily closed. However, governments have tried to balance public health concerns with economic needs by allowing food shipments and essential goods to continue crossing borders. Countries begin imposing travel bans. Fears of international spread increased. Several nations introduced travel restrictions. Canada announced a temporary ban on residents from the Democratic Republic of the Congo, Uganda, and South Sudan. The restrictions are expected to remain in place for several months. Even travelers without symptoms who recently visited affected regions may face mandatory quarantine requirements. Bahamas also introduced immediate entry restrictions for travelers arriving from affected countries. United States followed with some of the strictest measures. Non-citizens who recently traveled to affected regions have been barred from entering the country. Enhanced airport screening procedures have also been introduced for returning American citizens. Jordan and Bahrain have implemented similar restrictions, temporarily suspending entry for travelers arriving from countries linked to the outbreak. Interestingly, none of these countries have reported Ebola cases within their own borders. Their actions are aimed purely at prevention. Airports on high alert. Not every country has chosen outright travel bans. Some governments are focusing on enhanced screening instead. India has increased health checks at major international airports. Officials have also advised citizens to avoid non-essential travel to affected regions. Thailand has adopted strict arrival screening procedures. Travelers from high-risk countries must undergo health checks before being allowed entry. Mexico has likewise stepped up airport monitoring efforts. The goal is simple: detect potential cases early and prevent the virus from spreading internationally. Why is Ebola so dangerous? Ebola is one of the world's deadliest viral diseases. It spreads through direct contact with infected blood, bodily fluids, or contaminated objects. Unlike airborne viruses, Ebola does not spread easily through casual contact. However, once infections occur, Transmission can happen rapidly among family members, caregivers, and healthcare workers. The Bundibugyo strain causes severe hemorrhagic fever. Patients may experience high fever, vomiting, internal bleeding, and multiple organ complications. Without rapid medical intervention, the disease can be fatal. This is why health experts take every outbreak extremely seriously. Can the outbreak be stopped? According to the World Health Organization, the answer is yes. Health teams are already conducting contact tracing. Treatment centers are being established. Medical workers are identifying and isolating suspected cases. Public awareness campaigns are also helping. Communities understand how to reduce transmission. However, outbreak is currently moving faster than response efforts. Every day matters. Every new case increases the challenge. Yet there is reason for optimism that previous Ebola outbreaks have been successfully contained through aggressive public health measures. Experts believe the same can happen again. Is AIR travel safe? One of the biggest concerns for many people is air travel. Can Ebola spread through international flights? For now, aviation authorities say commercial air travel remains safe. International aviation organizations have advised governments not to panic or unnecessarily shut down global travel networks. Instead, they recommend rigorous screening of passengers before departure, health declarations, temperature checks, medical evaluations. These measures can help identify potential cases before travelers board aircraft. Experts stress that targeted screening is generally more effective than broad travel bans. The Ebola outbreak in Central Africa is a serious reminder that infectious diseases remain a global challenge. Within weeks, a regional health crisis has triggered international travel restrictions, border controls, enhanced airport screenings, and emergency response measures across multiple continents. Governments are acting cautiously. Health experts are working around the clock, and millions of people are watching developments closely. The coming weeks will determine whether containment efforts can outpace the virus. History has shown that Ebola can be defeated, but only through rapid action, international cooperation, and strong public health responses. For now, the world waits, hoping that this outbreak is contained before it becomes a much larger global emergency. Because in the fight against deadly diseases, every decision, every precaution, and every day can make the difference between containment and crisis.